think of all three terms interchangeably: insulin resistance and metabolic syndrome and hyperinsulinemia, which means you've got a chronically elevated level of insulin in your bloodstream.
93.2% of Americans are in poor metabolic health. High blood sugar, high blood pressure, high cholesterol, they're overweight, or they've had a heart attack or stroke, meaning they have insulin resistance. They have cancer, heart disease, diabetes, dementia, depression, infertility are caused by something called insulin resistance.
Having elevated insulin ages us more quickly.
There are longevity genes in the body that come on and protect us from aging and disease. Having high levels of insulin all day means your longevity genes are not switched on. So you're falling apart.
The root cause of it is insulin resistance. It's an insulin issue.
What kind of damage? That's neuropathies. That's like blind, the heart disease, stroke, memory loss, Alzheimer's, visceral fat. That's the fat around the gut.
Too much insulin. So
if insulin is the main problem, then you need to focus on lowering insulin, because if insulin makes you gain weight, you need to lower insulin.
But the glucose isn't the problem. The insulin's the problem. And the more insulin, the quicker you die. And that's been shown every 50 ways from Sunday also by a zillion different studies. United Kingdom Prospective Diabetes Study, the Accord Study, the Muraglitazar Study, the Advanced Study, etc.
The numbers are continually climbing with insulin resistance.
We became fatter, we became iller, we became more diabetic, we're getting more Alzheimer's, more cancer, more high blood pressure, and that's because the big elephant in the room is insulin.
My singular motivation is understanding insulin, and then in my own life, what am I doing to help my insulin stay low?
The American Diabetes Association does not think that insulin is important enough to measure, and insulin is the most important metabolic hormone, so it just seems like unfathomable that this is not part of a standard, that someone needs to step up.